Hello and welcome to Collaborations. Collaborations. This is Mabel Scott, the Public Information Officer with Rockingham County Government. And today with Collaborations, we're talking with Dr. Michelle Laws. She is the Assistant Director for Consumer Policy and Community Stakeholder Engagement for the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services within the North Carolina Department of Health and Human Services. That's quite a title, Dr. Long.
It is quite a title, a mouthful.
Please give us an overview of what you and your team do.
Thank you. And first of all, let me just say thank you for the invitation to join you, Dr. Scott. I'm really excited. Rockingham plays a special place in my heart. There is a woman, an elderly woman who's like a mentor of mine who's from Rockingham.
Oh.
And so, yes, and so every time I have an opportunity, I'm always ready to engage and reach beyond the Triangle area. Let's just say that.
Yes. You're so in Raleigh.
Our office is in Raleigh. I live in Chapel Hill, which is where I'm from originally, actually. So I was able to move back after I finished school at BCU School of Medicine in their Department of Health Behavior and Health Policy. And so, yes, but love getting down east, love going west. As much as I possibly can. Beautiful people all over the state of North Carolina, and especially in your area. So what the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services does is we oversee a lot of the policies and funding that is distributed and made available to mental health, substance use disorder, intellectual and developmental disability consumers in our state, specifically the public system. So people may be familiar with the LMEs and the MCOs. So Trillium, Alliance, Cardinal, those are 3 of our 7 LME MCOs. We have others, Sandhills, Via, Partners. We are responsible for the federal dollars that come into the state to provide services for those populations. And again, people with mental health conditions, substance use disorders, intellectual and developmental disabilities. And my team within the division is responsible for community stakeholder engagement and making sure that we are engaging stakeholders, including consumers and families. So people also may have heard of the state CFAC, Consumer and Family Advisory Council. We also have local CFACs that are affiliated with our LMEs and MCOs. In addition to that, my title as AD of Consumer Policy and Community and Stakeholder Engagement. So in addition to the Community and Stakeholder Engagement team, which I have a lead who oversees the field team, Suzanne Thompson, that works with our community engagement team, I also work with executive leadership to develop policies, to review our policies, to look at funding as it relates specifically to direct supports for consumers of our system. So we do a lot of work in partnership with what I call our sister agency, which is the Division of Health Benefits, also known as NC Medicaid.
So when you say consumers, you mean all of us across the state of North Carolina?
Absolutely. Yes. If you are receiving services through providers that are being paid through our public system, so all the public dollars,
I understand.
So the state appropriations, the federal dollars, they come through the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services for those services. And so it's for the state. And really it's important, I know we'll get to it, but it's especially important during this time as we think about what I perceive is the next wave of this COVID pandemic, which is going to be, I contend, or propose a mental health pandemic, right? When you think about, and behavioral health, We're already seeing numbers on the uptick or trending upwards in terms of substance use, in terms of suicide, in terms of mental health conditions, period, specifically anxiety and depression. I don't know if you saw the article or the publication that was released from CDC, where they identified at least 40% of Americans have reported some form of depression or anxiety during this COVID pandemic. And it's predictable, right? Because we know that when you think about some of the social determinants and some of the social drivers, and you think about the social and economic impact that what has been responded to in a lot of ways as a public health crisis, when you think about the social drivers and the economic factors in particular that's linked to this pandemic, such as, people losing their jobs and not being able to pay their mortgages, not being able to pay their rent. So that certainly is a predicted anxiety, heightened anxiety and depression and other forms of behavioral health conditions certainly is a predictable response and outcome. And so I'm very proud of the work that we are attempting to do and that we are doing to respond to that.
And I think that the background on the screen that you have placed fits. It's just perfect, because it's like what you just said, the basics that we all look forward to having, food, clothing, shelter,
Right.
a job, money, some type of money in our checking accounts. And when everything just gets pulled from under you, it's like the rug is just gone and you're just laying on the floor.
That's right.
Yeah.
Yeah. And so behind me is the division is having, I'm trying to turn my cell off, which I should have done before, but we have implemented what's called the SCOOP campaign, which really focuses on managing stress. And my area of expertise and background, the research that I've done, that I did, matriculating through with my, getting my PhD at VCU in the School of Medicine, focused on the impact of stress on psychosocial stress on health management behaviors. And so I'm really pleased that we chose stress management as one of the contributing factors to worsening of pre-existing and existing chronic health as well as mental health conditions, to focus in on stress, tying those two together, the physical as well as the mental. So we're asking people to make sure that they stay connected, that social distancing does not mean social isolation. And a lot of times we say isolation, we even have services focused on quarantine and isolation supports, because we know that one of the guidances and protocols in responding to a positive COVID test, or even someone who may have not tested positive but may think that they have been exposed, we say, well, make sure you go in quarantine and isolate away from others to prevent the spread of COVID. But what we want to make very clear to people, especially people with existing mental health conditions and substance use disorders, is that does not mean to completely isolate. We know that is a predictor of worsening conditions, as well as a mitigating factor in terms of whether or not somebody is successful in recovery. And so we're asking people to stay connected and make sure that you've got a good support system around you. And we're asking people to be compassionate for not only themselves, but also others. This has been a very difficult pandemic.
Yes.
It's a new coronavirus. So there's a lot we didn't know going into this pandemic. And there's also a lot that we're still learning about the pandemic and its effect, about the coronavirus and its effect, SARS-CoV-2. So we need to make sure that people are giving themselves time and practicing good self-care and self-love. And then also making sure that they know that it's okay to ask for help, and that they are observing any type of substance usage, and also that they're engaging in physical activity. So everybody laughs about the COVID-19 pounds that people are gaining, but we're asking people to make sure we know that physical activity, walking in particular, does wonders not only for our waistline and our heart, our cardiovascular fitness, but it also works wonders for our minds and our brain health. And so we're asking people to make sure that they also engage in physical activity. So all those letters together, the acronym SCOOP, really are instructions and guidance for people to help them to cope with and manage stress and to be well as we work our way through this COVID pandemic.
That's great. So how did the novel coronavirus change you and your job?
Well, wow. One, it made it a lot more demanding and challenging to manage. Put in a lot more hours.
I know it. I know it.
Yeah. So early on, I was asked by Deputy Secretary Cody Kinsley, who works directly side by side with Secretary Mandy Cohen. I was asked to come on and help lead the department's work around serving and responding to COVID's impact on historically marginalized populations. And we identify those as by race and ethnic categories, as well as immigrant and refugee statuses. So American Indians, African Americans or Blacks, Latinx or Hispanics, our immigrant population, as well as our refugee populations. We knew, many of us knew, we could predict. We knew that there were going to be disparate effects and impacts on communities of color, and also on communities that were already facing disparities in terms of access to and utilization of healthcare services, economic disparities, housing disparities. And so we knew that these populations were going to be hit the way that they were. And so when you think about, African Americans, when I first came in to my role as one of the co-leads for the historically marginalized populations team or work group, we saw, even though African Americans, for example, made up 20%, right at 20%, 22% of North Carolina's population, we were like 36 at one time, 38% of the cases, and also in the 30% or higher of the deaths. That number, thankfully, has gone down. It has trended down. And so and I'm very grateful for the work that our team has done to make that happen. The Latinx community, less than 10% or right at 10% of North Carolina's population, they were running, high 30s, yes. 40% of the cases, and but not nearly as high of the numbers of the deaths as we were seeing in the African American population. So it changed me in the sense, it changed my work that I do, that it added to the work that I do. But in my mind, I always had concerns about us responding to the pandemic purely from a public health and medical perspective without really leaning in early into the mental health space and look in behavioral health. Not that people didn't care, it's just that, I use the analogy, we knew that the house was on fire and we needed to put the fire out. But my caution was always, let's not put the fire out from the public health perspective and from the medical health perspective, and then realize that the house beside it, which was the behavioral health house, was also on fire. Mm-hmm. And so it just really changed. It added to the volume of work I did. It gave me an opportunity to reach a lot and engage with a lot more people than what I was doing on a routine basis on the behavioral health and IDD side. And so I'm very, very glad that I had a seat at the table. I pulled back a little bit from some of that work to really focus in on the behavioral health and IDD work that we know we need to do now.
So let's go on to the part about where we'd like for you to tell us how your office and what your office has produced in order to help to educate and inform and tell stakeholders what's going on and what we need to do?
Right. So in addition to my team on the behavioral health and IDD side, but also I want to just give kudos to Tracy Zimmerman, who is the lead for the communications office at DHHS. And so I had the extreme pleasure working side by side with Tracy to produce PSAs. We, of course, hired consultants, outside consultants, who specialize in that area. But before, I was able to recruit and to produce some of our earlier PSAs before we hired a consulting firm. So the PSA that you see running and airing on TV, Get Behind the Mask, that came out of the work that we do. Also, webinars, different webinars to educate people about different components that are important in terms of what we call our 4 pillars. The 4 pillars is a COVID response or testing, contact tracing, wraparound supports, particularly to help people quarantine and isolate without having to worry about mounting debt or not being able to pay their bills, not being able to have childcare and so forth. Yeah. And then behavioral health we've added, and as in the HMP side of things as a pillar also. But we, and then vaccinations, which is actually prevention, and under that is the vaccination. So we've produced educational and informational materials that's on our NC COVID website. We produced it in multiple languages, not just Spanish, but recognizing that we also have a refugee population that speaks different languages. Swahili is a huge, there's a huge population of Swahili speaking refugees that are working in some of our meat processing plants and other factory type work. And so we produced educational and informational, and on a weekly basis, we send out through our various listservs, information, updates on policies and guidances, updates on the governor's orders. So as you know, we are moving into phase 3. Yes. And so you should have in your inbox, as a matter of fact, the recent update. So we send out a lot of updates. We produce print materials that people can print out. Organizational leaders can print them out, whether it's faith-based organizations or community-based organizations can print out information to share with their constituents or congregations. So we've done quite a bit, and the 3 W's, which is now resonating and being used around the country, came from the work that was done in North Carolina through the comms team that I've worked on. But a lot of that work that you're seeing is the work that we do.
And those 3 W's, it is resonating. We're saying it over and over again.
It's so important.
Yes. What about the main challenges?
Dr. Scott, the main challenges that I see continue to be our reach, making sure that we're reaching the populations that are being hardest hit, that it's trickling down to the grassroots, without us being able to go door to door and knock, without us being able to go and put up flyers, which those old methods of disseminating health information, they worked, right? Going into the hair salons and barbershops. And so not being able to really do that, going to bus stations and laundromats and so forth. So the real challenge is making sure that we're getting the information to the people who are being hardest hit by this pandemic and who we really need to make sure they have information to help respond in a positive and a healthy and proactive and a preventive way. The other challenge, is centered around the vaccine. So there's a lot of concerns, a lot of reservations that people have about the vaccine. And from my perspective, we know the historical implications of African Americans, for example. I'll use our population or African Americans as an example. But this certainly is true for the American Indians. It's certainly true for the Hispanic and Latinx. There are also examples of where they were exploited and treated inhumanely and unjustly through medical research and clinical trials and so forth and the like. And in some instances, we know of the Tuskegee syphilis study, for example, in some instances, state-sanctioned or government-sanctioned studies and research. And so I think one of the challenges around the vaccine is really making sure that history doesn't get in the way of progress and get in the way of us responding in a healthy way and in a positive way. I always say when people say, well, you know, Blacks aren't trusting of research, that's not true. We're not trusting of the way in which research has been conducted, but we value science just like everybody else. We value knowledge just like everybody else. But we also have in our memory, in our collective memories, we also know that when we have come forth to participate, sometimes the outcomes have not been favorable. And so really educating people to not be afraid and to be informed and make informed decisions about the vaccine trials, the vaccination trials. And it's a challenge. And so that's one of the challenges is in making sure that people are getting trusted information from trusted sources, and that they're seeing enough faces like yours and mine, or if they're Latinx and Hispanic, like faces that look like them, if they're American Indian, if they're from a refugee population. So that's another challenge, making sure that the trusted voices are not just, represented by the majority or Caucasian experts, right? We need to make sure that the influencers represent the populations that we serve, because that's the way in which you build the trust that was broken and that was breached through historical violations of human rights and exploitation of research subjects that are represented among HMPs. So the vaccine, the messaging and disseminating that, and then probably the recovery.
Yeah.
We are in for I think a long haul in terms of the recovery, because I say this, and sometimes different audiences get it without me having to go through too far. It's not just that people are in jeopardy of losing homes and are losing their homes and places to stay, but people are taking credit hits, right, on their credit scores. And so when they do have to rebuild, their credit scores have been damaged that have made them, that have put them in positions where they're not likely to receive good, interest rates on loans or whatever they need. And so that's just one small example of how this public health crisis has had a compounding effect and has revealed some fault lines based on race and class and status, right? Where you are and where you start out in the pandemic greatly influences where you end up. And if you start out with very little, bad credit scores, living in a dilapidated housing or substandard housing, working minimum wage jobs, and not, if you start there and then you take the hits that are coming with the COVID pandemic, it's going to be very challenging to help certain populations recover. And so I think we need to invest in the right community-based as well as local and regional entities, organizations, agencies that are closest to the people that are suffering the most. And so that's going to be a challenge, making sure we're getting monies to our local governments and agencies and communities and based organizations and faith-based organizations so that they can help respond rapidly to the recovery.
In order to recover. Change is the only constant. How have you dealt with all of the constant COVID-19 changes since February and March?
I'm sorry, ask the question again.
How have you dealt with all of the constant changes that have happened since February and March with COVID-19?
Dr. Scott, so I say this, so I'm a woman of faith. And I'm reminded, Albert Einstein said, science without religion is of no use, and religion without science is dead too, right? So something, I'm paraphrasing, but so I don't shy away. I don't think it's, some people, only look from a scientific perspective, or they think to mix in religion or spirituality somehow, isn't sound thinking. I don't subscribe to that. So I'm a woman of faith, and my faith and the belief that my profession is also a ministry. The fact that I'm working for a division that serves very vulnerable populations, and that serves populations that at any time can go into a crisis, and that are relying on our systems working effectively. I consider that as a ministry. And so I've been able to adapt, because I really do consider it in a lot of ways, the work that I do, as a calling to do this work, to show up. I've been blessed where I haven't had COVID. My husband doesn't have COVID.
Thank God.
Our income has not changed through this pandemic. And to me, that's a blessing. So to deal with the changes in terms of the work and in terms of what we see, I just show up, and I show up ready to be used in a way that makes a difference and that helps other people who are not faring as well as I've been blessed to fare. And so that's how I respond. And I'm, do I get anxious? Absolutely. Do I, feel like Michelle Obama said that I'm having a low-grade form of depression? I wouldn't even say it's low-grade at certain times, in full disclosure. There are some times I look at all the information, and I look at where we are, and I look at the people that are hurting and that are suffering. And I do feel at times, a sense of just anxiety and depression about where we are, and my heart goes out to the people that we serve and that we need to serve. And so I cope, and I deal with all the changes on the work front, and even the changes of having to work from home. I'm a very social person. I would prefer to be out socializing. I would prefer to be out coming to people's houses and having brunches and dinners. And, I really enjoy that way of living, right? So I enjoy socializing and engaging. And so this has been a challenge for me, but again, I'm driven by the larger calling and purpose of our work and mission of our work. And I'm grateful to work for a team, especially our DMH, DD, and substance abuse services team, all of DHHS, but I can only speak of those that I work closest with. And so, I'm glad to work for a team that also is committed and driven with a passion to serve the people of North Carolina who are relying on our public systems.
And there are so many needs out there. We need all the help possible. All the help possible.
Absolutely.
We mentioned, and you mentioned earlier, Secretary Mandy Cohen emphasizing the 3 W's: wear, wait, wash. Yes. And this is critical, because we want people to realize this is serious and we can all make a difference.
That's right. And, people, the evidence, trust the science, trust the data. Mm-hmm. And I don't mean just trust data that pops up, here, maybe here in a magazine or here on a social media. No, these are vetted research scientists and epidemiologists, public health experts, who know, data, and who know how to do and conduct unbiased research and draw conclusions based on what the findings are and the evidence is showing. And so we know that wearing a face covering over your nose and mouth is a guaranteed way or one of the strongest ways that you can prevent the spread of COVID. It's not guaranteed that you won't get it, but it's one of the ways it has the highest probability of mitigating the spread. We also know that washing your hands and keeping a safe social distance, we recommend 6 feet or more, are also evidence-proven preventive measures. And so trust the science, trust the data. And we've seen, when people don't wear masks, for example, the news broke today about our president. When you don't, I so regret that, and I wish him and our First Lady, Melania Trump, I wish them a speedy recovery. When you don't trust the science and the data, you place people's lives at risk, including your own. And so the 3 W's, wearing a face cover over your nose and your mouth, and I had one somewhere.
I have mine.
Yes, that's right.
I'll demonstrate for you.
Please do. Thank you. Exactly. That's exactly right.
Okay.
And so wearing your face covering, as Dr. Scott is showing, washing your hands frequently, and also still wiping down counters, but washing your hands frequently. And then also when you're out in public, especially as we're easing the restrictions, maintaining a safe distance between yourself and other people, especially if they're not in your cohort, they're not in your house every day, and you're certain that they don't have COVID. So those are very important evidence-based preventive measures.
And this is our way of showing people who we love and people who we work with and associate with that we respect them, and we want to do everything possible to help to flatten the curve.
Yes.
Yes.
Absolutely.
Yes. So before we summarize, just tell us, and I think you've already said this in so many words, you really love your job.
I do. I get up every morning. I go to bed late at night working at my job and not feeling like, that it's a burden.
Yeah.
Do I get tired? Absolutely. Do I get overwhelmed? Absolutely. But again, I am driven with a purpose to serve the people of North Carolina. I'm very clear that in my position as an assistant director for the Division of Mental Health, DD and Substance Abuse Services, it's a privilege to be there, but also I'm a public servant. Yes. And even though I'm on the executive leadership team, I believe in servant leadership. And so what drives me is knowing we still have a whole lot more work to do. What drives me is knowing that we've got to build up a stronger mental health and substance use services, as well as IDD system. And for as long as I'm there, I'm committed to doing that. We've got people who are homeless with unmet mental health needs and substance use needs. We've got people who are in IDD facilities with certain needs. We've got people on an innovations waiver waiting list for IDD service who've been on there 10, 12 years, or more. And so there's a lot of work to do. And I get up every morning ready to do my part to serve the people of North Carolina who are depending on our system. So I love my job. I thank God for my job. And like I said, as a woman of faith, I consider it also very much a ministry.
We appreciate all the work that you and your colleagues are doing for us across the state. And we know that you are good stewards and you're taking care of us because it's right here in your heart. And we must all realize that in our roles, we are our brothers and our sisters' keepers. So we just want to thank you for sharing some of your valuable time with us here with Collaborations with Rockingham County Government. Again, we want to thank Dr. Michelle Laws and for all the work that's being done. And we certainly want to remember SCOOP, managing stress. Stay connected to family and friends. Have compassion for yourself and others. Observe your use of substances. It's okay to ask for help.
Yes.
And physical activity to improve your mood. So that means we're going to get some of those pounds off.
That's right.
Thank you so much for joining us.
You're so welcome.
Yes,
You're so
and
welcome.
we hope to see you one day soon in Rockingham County, North Carolina.
Absolutely. Look forward to it.
There. Okay.
Thank you. Take care. All right. Bye-bye.